Today we will discuss about the deep structure of the deep to the infratemporal fossa. Here we remove this is the masseter muscles. We already removed the mandibles, and we already dissected the infratemporal fossa and the deep structure. Here you can see this is the mandibular nerve, and this is the posterior belly of digastric. Along with it, this is the styloid muscles. I will reflect the posterior belly of digastric. This is the submandibular gland, and I will reflect it on the side. Here you can see this is a external carotid artery, and we already discussed the branches of external carotid artery. This is the hypoglossal nerve, and this is the nerve to geniohyoid. Now we will go to our topic. Here this is the styloid process, and there are two muscles we have cut from the styloid process. One is the upper one is the styloglossus, and the lower one is the stylopharyngeus muscles. These are the two muscles, and the stylohyoid we already reflected. These are the three muscles which is attached to the styloid process. So here you can see this is the styloid process, this one is the styloid process, and three muscles, styloglossus, stylopharyngeus and stylohyoid we have reflected from the styloid process. And I will go to the deep structure. Here you can see this is the glossopharyngeal nerve, and this glossopharyngeal nerve innervate to the stylopharyngeus muscles, and after that this glossopharyngeal nerve which is enter inside the pharynx between the superior constrictor and the middle constrictor muscles. This is the venous plexus of the pterygoid venous plexus. We have removed it. I will keep the inferior nerve on the side. Here you can see this is a lingual nerve, and this is a Coda Tympani nerve. I will show you the tracing of the Coda Tympani nerve. It is up to here. You can see this Coda Tympani which is coming from the facial nerve. This is a Coda Tympani nerve. And this is the malleus, and here you can see this is a external auditory meatus, and this is the tympanic plate. It lies, and this one is the middle ear. Here you can see this is the middle ear. This is a facial nerve, and this is a geniculate ganglion, and this is a facial nerve. So this is a acute angle. It is a geniculate nerve, and it gives a greater petrosal nerve. Now today we will discuss about the structure like auditory tube. We will discuss. It has a two-part. Auditory tube have a two-part. It is the cartilages part, and there is a bony part of the auditory tubes. It is also called the pharyngotympanic tube or Osseous tube, and osseous part it is the thin and non-ciliated flattened cuboidal epithelium, and cartilages part it is the ciliated columnar epithelium. The auditory tube it is nearly 36 mm in length. The bony part which lies on the lateral aspect, here this is the bony part which is lies start from the anterior side of the middle ear below to the tensor tympani muscles. Here you can see this is the trigeminal ganglion, and this muscle it is the tensor tympani muscle. This is the tensor tympani muscles. So just below to the tensor tympani there is a anteriorly there is a bony canal, and it is the osseous part of the Osseous tube, and there is a just continuation. It is the internally, and the medially it is open inside the pharynx by the internal auditory tube, or it is also called the pharyngeal end of the Osseous tube. This is the pharyngeal end of the Osseous tube, and there is above to it there is a tubal elevations. So total length of the Osseous tube it is the 36 mm. Bony part it is the 12 mm in length, and the 24 mm length it is the fibrocartilageous part. It is the medial part of the Osseous tube. Now osseous part begin with the anterior wall of the tympanic cavity, and the boundaries of the osseous part, here you can see this is the bony part, Here the above, there is a, I already show you, there is a above, it is formed by the one muscle, it is called the tensor tympani muscles. This is the fiber of the tensor tympani muscles. So above it is the tensor tympani muscles. Below by the tympanic plate of the temporal bone, here you can see below it is by the tympanic plate of the temporal bone. Medially there is a internal carotid artery and there is a carotid canal. Medially carotid canal contains the internal carotid artery and the plexus around it. Laterally there is a downwards edge of the tegmen tympani. It is the bony boundaries of the Ischian tube. So the bony boundary of the Ischian tube, laterally it is the downward edge of the tegmen tympani, which is here also you can see internally downward edge of the tegmen tympani, and the medially it is bounded by the carotid canal, laterally by the medially by the carotid canal, and above by the tensor tympani muscles. I will also show you the tensor tympani muscles, and below by the tympanic plate of the temporal bone. Now we will discuss about the boundaries of the cartilageous part of the auditory tubes. The anteriorly and laterally it is bounded by the, there is a mandibular nerve. Here you can see this is the mandibular nerve, this is a mandibular nerve. So laterally by the mandibular nerve. Tensor veli palatini, I will show you the tensor veli palatini deep to the mandibular nerve and otic ganglion. The muscles, it is the tensor veli palatini. So this is the tensor veli palatini muscles, this is the tensor veli palatini, and this is the cartilageous part of the fibrocartilageous part of the Ischian tube. This is the muscles fiber of the superior constrictor. So deep to the mandibular nerve there is a otic ganglion and there is a two muscles. One is the tensor veli palatini. This is the tensor veli palatini and this is the superior constrictor muscles. And deep to it there is a, this is the deep to it there is a deep to it this is the cartilageous part of the pharyngotympanic tubes, and this is the superior constrictor, and the pharyngotympanic tube, which is through the gap between the superior constrictor and base of the skull, it is called the foramen morgagni, and from this it passes the auditory tubes. So the laterally it is bounded by the Coda tympani now. This is the Coda tympani now. I will show you. This is the Coda tympani, mandibular now, otic ganglion, tensor veli palatini, and middle meningeal artery. So this is the middle meningeal artery. So these are the structure lies laterally, and the posteromedially there is a petrous part of the temporal bone. So here deep to it, here you can see there is a petrous part of the temporal bone. So internally there is a petrous part of the temporal bone. This is the petrous part of the temporal bone. Above this is the sulcus tubi. This is the upper boundary. It is the sulcus tubi. And below there is a, already I show you, this is the superior constrictor muscle. So below it is bounded by the superior constrictor, and there is a processus tuberous. Here you can see this is the processus tuberous. It is the process which is coming from the medial pterygoid plate. It is called the processus tuberous, and it is a triangular projection of the bone from the posterior border of the medial pterygoid plate. So this is the boundary which lies on the inferior aspect of the, or below, it is the below to the Ischian tube. Mainly you have to remember there is a superior constrictor muscles which is lies below to the its. So the boundaries of the, this is the boundary of the cartilageous part. Which are the muscles attached to the sulcus tubae? This is the sulcus tubae. Laterally it is attached by the tensor veli palatini, and medial to this there is a muscles. This muscles, it is the levator veli palatini. This is the levator veli palatini, and there is a internally inside the fold of the auditory opening, pharyngeal opening, there is a internally inside the tubal, there is a salpingopharyngeus muscles, and also tensor tympani muscles. So these are the attachment of the medial lamina of the attachment of the Ischian tube. Blood supply by the branches of the maxillary artery, mainly the middle meningeal artery, also the artery to the pterygoid canal, ascending pharyngeal branch of the external carotid artery. Venous drainage inside the pterygoid venous plexus. This is a pterygoid venous plexus. It is a venous drainage, and the pharyngeal venous plexus. And lymphatics, it is the retropharyngeal and upper deep cervical lymph node. It is a lymphatic drainage of the Ischian tube. Entire tube which is supplied by the branches coming from the glossopharyngeal nerve just below to the stylopharyngeus. Here you can see this is a glossopharyngeal nerve. So whole the tube which is supplied by the glossopharyngeal nerve, this is a glossopharyngeal nerve, and pharyngeal part where there is a opening of the Ischian tube, this part which is supplied by the branches, pharyngeal branch of the pterygopalatine ganglion. So this part which is supplied by the pharyngeal branch of the pterygopalatine ganglion. So the pharyngeal part which is supplied by the pharyngeal branch of the pterygopalatine ganglion. And development, it is developed from the tubotympanic recess, which is formed by the fusion of the dorsal part of the first and second pharyngeal pouch. So it is the development of the pharyngotympanic tube.